Alright, so for the next condition of the cervix, which we'll get to discuss, this is what is known as cervical incompetence or cervical insufficiency. Alright, cervical incompetence or cervical insufficiency. Okay, so for this one, we just have it that cervical incompetence is also known as cervical insufficiency. So just look at this. A normal cervix should be as big as this or thick as this, but in cervical insufficiency, it's kind of like looking very small. All right, so it's just a condition where the cervix begins to open too early during pregnancy. Do you understand? It's becoming small. All right, so it will make it easier for it to open. Do you understand? All right, so typically the cervix is opening up in the second trimester. There's no contractions, there's no labor, but cervix is opening up. So this can lead to the baby going out too early. That's a miscarriage or a premature birth, especially before the fetus is actually competent to be outside. So it could be congenital factors, like you just have an abnormal uterus, all right, or your cervix is not developing properly, or connective tissue disorders like Ehlers-Danlos, Marfan syndrome, where everything in the body is laxed. Maybe there was a previous cervical trauma before, you had issues in the cervix before, multiple pregnancies, there's so much load or genetic predisposition, you are just born with a weak cervix. Okay, so symptoms is often subtle or absent. Sometimes pelvic pressure or mild cramping, vaginal spotting or discharge changes, backache, cervical shortening or dilation. So diagnosis, of course, you have to do all those imagings and examinations. So transvaginal ultrasound, pelvic examination, fetal fibronectin test, then medical history. All right, so just medical history, you want to just have it that okay, maybe the woman had this issue previously. So treatment options is a cervical cerclage. Now cervical cerclage, they basically kind of like stitch up the cervix so that it can hold the baby back for longer time. Progesterone therapy, close monitoring, lifestyle adjustments, all of these are basically important in management.